when we had this opportunity to ask the question, is Lewisburg the right place for us to be? Is this the right place for us to really put down a bigger footprint to understand how we deliver care? And we look carefully at where patients come, not just from this local community, but the regional communities that we serve. It was very clear. And then when we did this, it wasn't about reproducing a space, it's about creating a space that's the right environment. And the feeling that I'd like us to think about is, we're a service no one ever wants to need. But when there is the need, we need to be there, we need to be ready.
Having windows is really important because you could be here for 8 hours a day. So having something to look at, being able to look outside, being able to feel part of a bigger space is really important when you're here for such a long period of time. So
this is our linear accelerator. It's brand new. It is a Varian TrueBeam. Has all of the bells and whistles that we could possibly want or need. So the patient comes in, lays down on the table, the therapist line them up, get them into position. We have what is called onboard imaging right on the linear accelerator so that we are actually able to do a CT scan of the area that we're going to treat. The physician can look at that CT scan, make sure that we are lined up exactly where we need to be, to target the tumor. We also have what is called surface guidance imaging, which actually looks at the patient's surface. It's another safeguard to make sure that the patient doesn't move, during treatment, so that we are targeted right on the tumor area. The machine actually rotates around the patient, so the patient just lays on the table, and the machine can go a full 360 degrees around the patient, and it can actually deliver radiation as it's moving. So what that allows us to do is really target the area of interest, but spare radiation to normal structures.
We expanded knowing that some of our patient care is delivered over in Danville, so if something like a bone marrow transplant is done in Danville, but the follow-up care can be done here. So that matters. Time is kind of our most precious resource for this patient population, and the less time in your car, the better. So if we can, if their primary physician's over in Danville, that's fine, and they can be seen by an oncologist here. The bone marrow transplant doctor over in Danville can see them, take care of them, and they can come here to get their hydration versus going to Danville. So that matters.